The introduction of digital technologies has revolutionized various aspects of human life, with more business processes being transformed from the hitherto manual and orthodox methods to more advanced methods. The healthcare sector is no exception. It has also embraced digitalization to improve the quality of healthcare provided to patients. Dr. Femi Kuti, CEO and co-founder of Reliance Health, discussed the challenges and prospects of this invention in Nigeria's health sector.
I think one thing that we should look at overall is that technology has sort of permeated everything across all demographics in Nigeria. If you look, say, 15, 20 years ago, the average, cattle farmer, in some rural part of Nigeria didn't have a cell phone, talk less of having access to the internet. So now we're at a point where, a significant proportion of the Nigerian population has access to a cell phone. Yeah. Maybe a little bit less, but still a significant proportion of the Nigerian population has access to internet. So the truth is that the infrastructure does exist for us to be able to use digital health and make the gains of digital health come through. Sometimes what the challenge is that just getting those solutions through to that infrastructure sometimes can be challenging. So some of that challenge happens from the point of view of the builders. Are they building the right solutions that can function for the customers, considering the infrastructure that exists? And some part of it is also about distribution. So even if you build a great solution, there's a joke that no matter how great your mousetrap is, if it's somewhere in the forest, nobody's ever going to use it, nobody knows it exists. So distribution is also a big part of the challenge. And how do we get that into the hands of as many people? So some of that needs to come from the government in terms of government support. Some of that also needs to come from the private sector, like HMOs like ourselves.
All right, let's have your thoughts on healthcare insurance in Nigeria. Where are we currently? Because this is also part of one of the major challenges over time regarding the well-being of people, as it were.
Yeah, so the current situation that we're in is very interesting. I would say that we are at an inflection point. So we're just coming out of very interesting position, but into the brighter part of the tunnel. I wouldn't say we're out of the tunnel yet. If you look at the demographics, about only 2 out of every 10 Nigerians have access to health insurance. If you have a room of 10 people, probably only 2 of them have access to any form of health insurance, either public or private sector provided. You also have a situation where those who do have access have to sometimes deal with, poor customer service. For people who have some form of health insurance, one of the most common refrains is, I go to the hospital, they don't want to attend to me because I'm an HMO customer. So that's kind of what we've been sort of struggling with. But I think we're getting to this inflection point where a lot of change is coming. Dr. Kelechi Ohiri's administration at the Nigerian Health Insurance Agency is phenomenal, as well as Professor Ali Pate's at the Ministry of Health, trying to change the landscape around regulation, making it more focused and really upping the game for HMOs. There's also a lot of players, private sector players like ourselves, that are trying to bring in innovations around technology to make this a lot better for existing customers.
All right, permit me now, because when you work in the HMO sector, certainly you have an overview of the state of the health sector, so to speak, because usually there is always a sticking point when people talk about making the migration, or what people call jackpot abroad, and they always tend to, probably, lack of a better word, they always tend to spit on the health sector in Nigeria, and they will say the health sector in Nigeria is completely useless. And that's the reason why they are going abroad, because they cannot get quality health service in Nigeria as against what is obtainable maybe in Canada, the United States, in the UK. And sometimes I look and say that we're not dying like flies here in Nigeria. So something is actually not adding up here. Yeah. Talk to us, how bad or how good is the health sector in Nigeria as one that probably deals with different hospitals and also interface with the general health sector and ecosystem in Nigeria?
Yeah, I think to just take a step back, the JAPA phenomenon is it's multifactorial. There's so many parts of it that partially emotional, partially experience that people have. I think I know people personally who have had maybe one bad healthcare experience with themselves or a family member, and that's sort of what's triggered their decision. We can't minimize that, and we have to recognize that that's valid for their own, in their own circumstances. But if you look broadly, the Nigerian healthcare system is like, we're not there yet. We still have our challenges, but it's massively improved over the last 10 years. You know, you have significant multi-specialist hospitals that have opened across Lagos and other major cities in the country that are doing a lot of like higher end surgeries that typically people would have had to travel abroad for. We're having a big, let me say, reverse, maybe not full migration, but a reverse sort of skills transfer from doctors, surgeons, physicians who have trained abroad. Some maybe initially started their training here. I trained in Nigeria, for example, so I have a lot of like doctor friends and colleagues who have trained in Nigeria, gone abroad, gotten skills, and are finding ways to bring those skills back. So that's essentially elevated the healthcare landscape. A lot of investment has also gone in. There are a lot of international organizations, international financial institutions investing in healthcare. That being said, we're not there yet. You know, there's still significant gaps. We still have high.
But is it as bad as people make it seem?
It's a difficult question to answer because, like, it's difficult to say how people make it seem. You know, healthcare is a very personal experience. You know, so if somebody has lost a child,
and that's the reason why I'm asking you this question, because you actually connect. You are the connecting rod on almost all sides of the spectrum, from the health care delivery service to the patients themselves who want to get this health care. So that is why I'm asking the question, and I'm hoping for a straight answer.
The thing is that it's difficult to provide a straight answer. And the reason it's difficult to provide a straight answer is because healthcare is a very personal thing, you know. No matter how much anybody comes on national television and says, oh, you know, our healthcare system is fantastic and it's working perfectly. If you are an individual who has lost a family member in some scenario where maybe things didn't, you know, maybe something went a little bit wrong, or for some reason that you don't understand, it's difficult to convince such a person that the healthcare system works. So, we also need to be empathetic to those scenarios. But the thing is that if you look at the actual numbers, we are still challenged in certain areas. You know, we still are not doing as good as we should be doing in cases around maternal and child mortality. But in other areas as well, we are definitely improving. So it's sort of like a balance, you know. In some cases we're doing well, in some cases we're not. But one thing I do want to point out though is that, like, sometimes we have an image of nirvana or heaven in other countries. It's absolutely not the case. Canada, for example, struggles with significant wait times to be able to access, you know, secondary care. The UK in the NHS is having a lot of pressure in the NHS now. Anybody who lives in the UK would tell you that sometimes it takes years to have access to something like a transplant, right? The US has one of the most expensive healthcare systems in the world. I was actually on a WhatsApp group recently where they were joking about a friend who had like a health issue and wanted to get to the hospital. And it wasn't a healthcare. It was actually the CEO of JP Morgan, who had an aortic rupture. The aorta is a big blood vessel which had ruptured. Called his doctor, and he was like, "Don't take the ambulance. Just ask your driver or call the cab to drop you." Well, this is one of the richest people in the world, right? Like, but it just costs so much. We're talking about tens of thousands of dollars to use even something as simple as an ambulance. But the point is, like, healthcare everywhere has its challenges. It has its difficulties. There's no heaven anywhere. In Nigeria, we have our challenges. We also have places that we're doing pretty well. So it kind of balances out.
All right. I even still remember there was a report not too long ago where the public was livid, where the NHS has been used to fund cosmetic surgery. People weren't happy with that, whereby there are more important cases, backlog of them, as you know, still on the waiting list. So when implementing digital health solutions, what are some of the ethical considerations that need to be addressed, do you think?
It's a really good question, and very rarely do we talk about ethical considerations when, I mean, many times we're just trying to build something that works that people can use. But I would say that there are two big ethical considerations in our ecosystem. I think one would just be around quality of care. So sometimes people believe that an HMO is trying to provide you with, you know, the cheapest medication, the cheapest doctors that it possibly can, so they can increase profit. very rarely does it work that way. Definitely, I can speak to Reliance Health and Reliance HMO. That's not how we operate. The reason is because it's not really in our interest for people to have bad care, because if they do, they're going to come back. If you have malaria that's not treated properly, it's not going to go away. It's just going to get worse. So it's actually, and when it gets worse, it's more expensive to treat. So it's actually in the interest to sort of kind of treat people pretty well the first time. But that's something that, people kind of ethically consider. This, like, are we getting access to the best medication? Some players are doing it a lot better than others, if I'm going to be perfectly honest. The other big consideration, especially in today's world, is around data, just data privacy. Healthcare data is probably amongst the most precious personal data sets that people have. It's almost like, anybody that has access to your healthcare, it's almost like you're naked to that person. It's like your deepest, most important piece of data. So it needs to be treated with that level of respect. Thankfully, we have the Nigerian Data Protection Regulation that's been enforced and stuff. So that's something that, for example, we at Reliance Health consider very strongly. How do we make sure that the precious healthcare data of individuals are protected and it's not in undue hands and it's used properly?
All right, we barely have 2 minutes to go, but quickly, if you can answer for me, how do we build trust within this ecosystem? Because, like I've noticed, hospitals don't trust HMOs.
Absolutely.
HMOs don't trust hospitals. Absolutely. Everybody is suspicious of everybody.
Absolutely.
Then the patients are caught smack in the middle of all this.
Absolutely.
How can trust be built?
That's a fantastic one. And I think it's probably one of the best questions that I've gotten asked in recent times. Because the reason why I think it's a great question is, as we all know, Nigeria can be a very low trust environment, very low trust community. And many of the challenges that we have are because of low trust. Do I think this person is doing the right thing? I'm going to do this thing to protect myself. And it makes the whole process a lot more complicated. The way we sort of think about trust at Reliance Health is delivering on a promise. If you tell somebody, hey, I am going to be at this point by 12 p.m. or 12 noon, and you're there at 12 noon, and it happens once, it happens twice, happens 3 times, that's trust. Trust is essentially believing that somebody is going to do what they say they're going to do, and then you can act accordingly. So what we've done, for example, is we noticed before we came into market that a lot of the reason for the mistrust was hospitals would say, well, pay us X for this medication. The HMO would say, okay, fine, initially, we'll pay you X for that. After a while, you know what? We're not really sure we should pay you X because we think of this and that. And of course, that's where trust becomes broken. So I think the key way in which we can build trust is, one, just having an agreement around what are the terms of service, how are we going to operate, and keeping to that agreement on both sides. The other thing is also around communication. So sometimes, especially on the patient side, where the breaking trust happens is because we're just not telling the person early enough or in advance enough of what's happening. And a great example would be delivery. So if you order a meal from a delivery platform and they tell you your food is going to be here in 2 hours. Okay, an hour and a half, you're not too bothered. 2 hours is right. It's you're fine. But if they tell you it's going to be here in 15 minutes and it gets here in 30 minutes, you're going to feel more angry, even though it came earlier than the person who told you about 2 hours. So it's, in summary, communicating with customers and telling them that, hey, this is what's going to be delivered, and fulfilling that promise. So the summary is communication and fulfilling promises. And that's really how we build trust in the ecosystem.